Here you go. I'll start letting people in.
Okay, just wait. Hello, good morning, everybody, and good evening also for you guys. Thanks for joining us in this media briefing session made from BFFP and also GAIA. And how are you today? I hope all of us are in the good condition and stay healthy so we can be more productive in the pandemic that already become our daily issues this whole years. And happy Easter for you guys who celebrate the Easter. And I'm Adi Marcella, your host. I'm working as a freelance journalist in Bandung, West Java, Indonesia. And today is another media briefing from BFFP and GAIA. And like the previous one with Tara Quismondo. Good morning, Tara. I see you already jump in this media briefing. We will discuss and learn another topic about waste issue in general. But for today's topic, we are going to talk about the toxic chemicals in food packaging because this is maybe the next pandemic and we already know it's going to happen, and it's better for us to know how to handle it and how to deal it and how to socialize this kind of issue to the public, because most of us outside the activists in the environmental issue, we are a journalist. So this World Health Day, the Global Alliance for Incinerator Alternatives, GAIA Asia Pacific, and the Break Free from Plastic would like all of us journalists to deep dive into another pandemic that wait to happen around the globe. So no matter what is your background, what is your profession, your status, your economic, uh, it will happen to all of us. Another pandemic is the disease came from the toxic chemicals in our food packaging. Just like in my hometown in Bandung, where people try to order food because they not allowed or they choose not to go outside to the restaurant or to buy something because they trying to avoiding the virus and try not to spread the virus if they already impact from the COVID. So we have seen the rise of plastic and also another packaging with cardboard or paper during this pandemic outside the health facilities, because in the health facilities we also know that the private protection equipments or PPE, strangers for vaccines, and also the online deliveries for just anything and everything we need, including food, not knowing that while we are trying to distance ourselves from the virus, we are bringing the toxic chemicals in this plastic into our home or into our family. So the good news, there is some cities who went on with the ban in the time of COVID, such as Jakarta in Indonesia, as well as fast food restaurant that recently banned the toxic chemical PFAS or the perfluoroalkyl in their food packaging. Uh, in the early January 2021, the international fast food chain in the world, McDonald's, announced that they are banning the PFAS in their use for the packaging. But today, they already serve 25 million customers daily at more than 38,000 McDonald's restaurants worldwide. So this is happening, and we still have some question. Why are we not banning single-use plastic? And why are we silent about another toxic chemicals? Because by reducing the amount of the PFAS in single-use, like food packaging, it can drop the amount of such chemicals in the landfills. For many areas in Indonesia, landfill is still a problem because we can see the leakage. They come to the soil and also to the water, and it will impact the people and also the health of the people. So today, nearly 200 environmental and public health organizations led by the UNREP project. We have a speaker also from the UNREP. She will explain what are they doing with this project, so we can know what is the impact and also the dangers if we are not ready to avoid or to manage the pandemic it's waiting to happen. So I hope we can elaborate more about this during the discussion. But enough for me for talking, because we have a panel of guests from environmental groups that are very active in the campaign in addressing this kind of issue. So today, I think we have Miriam Gordon. She is a policy director for Upstream. She's an architect of policies that reduce single-use products and packaging, also a leading advocate for plastic reduction policies. Miriam has experience working for NGO and local state for over than 30 years, and also in the federal government in the US. So Miriam is an expert on waste, water quality, and also toxic chemicals policy. And we also have our guest from Hong Kong. Hi, Michelle Chang. She is a senior project officer and lead of the Stop campaign at Greeners Action in Hong Kong. She has 4-year experience in environmental conservation organization and an international wildlife rescue volunteer in Africa, South America, and Asia. The last but not least, Paeng Lopez. He is a plastic in healthcare project officer in Philippines. So Paeng has been in the environmental movement since his college and had worked as youth convener, community organizer, project coordinator, and researcher for various conservation organizations. So I would like to jump into our discussion. Like I said before, that McDonald's in the early January 2021 announced a new global sustainability packaging commitment, banning the class of toxic chemical and PFAS from gas packaging material. So why journalists need to know about this kind of issue? Because journalists maybe know a lot of things, but maybe it's just on the surface. So we need the expert or the people who jump in the issue to give us more information so we can write and we can report, make a story to the people, to the public in a popular way. So I can join this and know about this kind of issue. Why? Because in the October 2019, I have privilege in taking part in fellowship hosted by the GAIA and also BFFP in Penang, Malaysia. So I learned about the impact from the single-use plastic, and also I learned about the initiative that already implemented and work for tackling at least the consumption or plastic use. So today, my other fellow will also join in this today discussion. So enough for me talking a lot. So I wanna ask you, Miriam, what do you think is the problem from toxic chemicals in food packaging? Please, Miriam.
Thank you so much. Well, there has been a lot published in the last decade on the dramatic threats posed by plastics in the ocean, and even the climate impacts of plastics are well documented. But What we don't really have that much information about in the public is the health risks associated not only with plastics, but with all kinds of food packaging due to the chemicals that are added to the packaging. And the Unwrapped project is attempting to present that information to the public. It's a project aimed at translating the science for the general public of food packaging and plastics that threaten our health. Our project works with a group of scientists led by the Food Packaging Forum, who published a consensus statement in March 2020 about the health risks of food packaging chemicals. And that consensus statement, published in Environmental Health, a peer-reviewed journal, made 5 key points about the health risks that I want to share with you today. So the first point is that when consuming food and beverages that are packaged, people are exposed to a wide array of chemicals that originate in the packaging, but migrate into the food and beverages that we consume. There are over 12,000 chemicals that are intentionally used in the manufacture of food packaging. An enormous body of research, around 1,200 peer-reviewed scientific studies, demonstrates clearly that these food packaging chemicals migrate into the food and beverages that we consume, and that a large majority of the human population is exposed to some or many of these chemicals. The second point is that many of the chemicals associated with packaging are either hazardous to human health or their risks have not been studied. Several chemicals hazardous to human health in that they are either carcinogenic or mutagenic or toxic to our reproductive systems, or persistent and bioaccumulative. Several of these chemicals and classes of chemicals are authorized for food packaging, not including things like phthalates, which make plastics softer, and bisphenols, which make them harder. And these per and polyfluoral alkyl substances, PFAS, which create moisture and moisture-proof and grease-proof barriers, and perchlorate, which acts as a biocide to maintain the shelf life of food. These are classes of chemicals that are known to be hazardous to human health, and for which there is a great body of research. But many chemicals used in food packaging have never been tested for human health effects. In fact, where I come from in the US, only 30% of the chemicals authorized for use in food packaging have been tested for toxicity to humans. And the regulations for keeping us safe all across the world are really lacking in requiring strict testing and demonstration that the chemicals are safe before they can be used. The third point is that food packaging is one of the most significant sources of dietary exposure to human-made chemicals, even greater than pesticides. Food packaging chemicals are present in food at far higher levels than pesticide residues, in fact, 100 times greater than pesticides. And food packaging has been estimated to be the most relevant and significant human exposure source for plasticizers, like the bisphenols and the phthalates that cause endocrine disruption and a whole host of human health effects, chronic disease, cancer, reproductive health disruption. The fourth point is that human exposure to and threats from chemicals in food packaging are likely unestimated because of the regulatory failure to require adequate testing, and also failure of the regulatory programs to recognize threats posed by very low dose exposures. Most regulations believe that the dose makes the poison. In other words, the higher the exposure, the higher the dose, the greater the risk. But with endocrine disrupting chemicals, that's not true at all. In fact, they can be health harming at extremely low doses. For example, in Europe, the regulations say that if the migration level is below 10 parts per billion, the chemical doesn't have to be regulated. And in the US, it's 0.5 parts per billion. That's the threshold of regulation. But the level of exposure to endocrine disrupting chemicals is that can cause harm is much, much lower than these thresholds. And failures of the and another factor is that regulations fail to take into account the threats posed by mixtures of harmful chemicals, which many packaging items have a great number of mixtures. And so the final point from the Unwrapped project is the fifth point is that microplastics are an additional growing source of concern for human health. So it's not just the plastics it's not just the chemicals that migrate out of packaging, but micro and nano particles of plastic also migrate out of food packaging. And these micro and nanoplastics are present in the air we breathe, the water we drink, and the food we consume. Even water bottles are a source of microplastic migration. And these microplastics in our bodies can degrade to such a small scale that they become nanoplastics, and they migrate across cell walls, moving across the blood-brain barrier to enter the brain, across the placenta to reach the developing fetus, and they accumulate in all of the major organs in the body. We don't know exactly yet what the health effects are of these micro and nanoplastics, but they are an extreme cause for concern. So the Unwrapped project has called for action to protect public health from exposure to food packaging chemicals and plastics, and call for better regulation of the chemicals and adopting policies that support a transition towards safer, reusable, and refillable packaging. Thank you.
Okay, Miriam. So we have a plastic issue, and now we have the chemicals issue also in our food packaging. And for you who are joining us through the FB GAIA Live, you can also find the information about the Unwrap project on their website, the unwrapproject.org/chemical in food packaging. So you can study more about what kind of chemicals and what kind of the code of the chemicals that is hazardous for the human health. But please don't be confused, because there are only 30% of the chemicals that Miriam said already tested for toxicity, and the others is still mystery, or I guess still not known what is the impact for the human health. So I would like to jump into Michelle from Hong Kong. Maybe you can share to us about how bad is the plastic issue from your perspective in Hong Kong and from your movement that you are doing in Hong Kong. Please, Michelle. Still mute? I still cannot hear you. No. Okay, we will jump in. We will try to talk with Pang before. We will try to contact with you later. Maybe you can join us again in Zoom so we can help the technical issue. Okay, Pang, what do you think about the issue of the plastic waste? And also because you are in the health center, or I mean in the health facilities, can you explain to us how bad is the plastic issue and also the packaging in the health sector? Please, Pang.
Yes, thank you, Adi. So before I start, first off, I'd like to greet everyone who's watching us today a happy World Health Day. So despite the pandemic, we're still commemorating the Health Day. So happy World Health Day to everyone. Second, yeah, I'd like to answer your question now. So the problem with plastics in the health sector has been in existence prior to the pandemic. So we've been doing waste audits in hospitals since 2018, and we have been seeing the increase of plastic wastes in the hospitals. And we did again another series of waste audits during the pandemic. And we are realizing that the types of plastic waste that are being produced in the hospitals right now just sort of changed its face. So from single-use packaging, from food or single-use plastics from different types, no. Now what we're seeing is that there's a surge of single-use plastics, particularly PPEs. But that doesn't say that the other types of plastics, which we call non-essential plastics, that are, when we say that, those are types of plastics that are not necessary in the service of health for the patients. So what we're talking about here are plastic utensils, for example, or single-use sachets in the cafeteria, so things like that. So those non-essential plastics are still very much prevalent, and there has been a surge of, instead of using their traditional reusable utensils in the cafeteria, or I mean the dietary department, because of the fear of infection in hospitals. So what they're using now dominantly are disposable plastic. So they send food to their patients and their frontliners throughout the hospitals packed in disposable materials, and that comes also with disposable utensils, plastic bottles, etc. So there's a lot of single-use plastic waste that are coming out of the hospitals on top of the surging single-use PPEs. So the picture is not very encouraging at the moment, if I may say. But there's a bright ray of hope, though, because the Department of Health has been very active in trying to curtail the effects of plastic pollutions in the hospitals. So right now, they're cooking a memorandum to address plastic pollutions in the hospitals, and I hope that comes out soon. And also, it is also to say that the waste audits that we've been conducting during the pandemic was being done in cooperation with the Department of Health. So there's a good initiative. There's an initiative from the Ministry of Health in the Philippines to address plastics pollution. So I think that that is a clarion call, no, for the health sector to step out of the comforts of their hospitals and their clinics, and follow through with their professional oath to do no harm. So expanding that oath to take into consideration their environmental, climate, plastic pollution footprint, and exercise that in order to minimize their footprint and defend the health of not just the environment, but also the very people that they're trying to defend, whose health they're trying to defend.
So how long is the process to the memorandum already done?
It's being finalized, actually. It's awaiting the signature of the Secretary of Health. So pretty soon. So we're looking at a window of a few weeks, perhaps, at the most.
Let's pray for the best for you guys in the health sector, because you already stepped to another positive tone in banning the non-essential plastic and also the SUP. Maybe it can help also the people and the environmental. So Michelle already joined with us again. Hi, Michelle.
Yeah, can you hear me now?
Yeah, I can hear you now. The same question from you. For you, it's about how bad is the plastic waste issue, and what is your doing with your organization in Hong Kong to tackle this issue?
Yeah. So I have some statistics to share with you as we conduct in last year during the pandemic period. So in last year, we estimate that there is over 100 billion pieces of single-use plastic have consumed every week, including the plastic straw and then plastic container or plastic bag. This number is from about 2,000 Hong Kong people. They did the survey for us. And then in the survey, it showed that the number of people who consume more than 5 pieces of single-use plastic per week, increasing from 10% in 2019 to 30% during last year. So from this statistic, we think that there's more than 5 pieces of single-use plastic container per week, increased from 12 to in 2019 to 45% during the pandemic period. So we estimate that there is 100 billion pieces of single-use plastic are consumed every week, and this figure has 2.2 times of the similar survey we undertook in 2019. So it's like 20% more, 200% more than previous year, because of the government. They don't allow people gathering in the restaurant, and then people, they have to buy their takeaway back to their home or somewhere to have their meal. So in Hong Kong, the problem is really serious in the food packaging. So that's for my side for the statistics.
Can you elaborate more about how serious is the problem for the food packaging? And maybe you can explain about all the enterprises relating with the F&B sector. They are more to choose the plastic or rather than use the paper or cardboard or?
In Hong Kong restaurants, they normally use PP for the container. So some of them will use paper, but mainly PP, because Hong Kong, the meal is mainly the rice or the noodles. So there's a huge amount of PP container in Hong Kong. But and Hong Kong people is not used to use their own container to the restaurant to buy their meal. So therefore, I can say every Hong Kong people, they would use plastic for their meal in general.
Okay, thank you, Michelle. So it's kind of challenging because everybody wants to be more practice and suitable for their own food, or they're buying something and they need to be easy and it's not hard. But I think it's also a problem for us to avoid the impact of the plastic and also the toxic chemicals in our environmental and also human health. So before we heard already that Miriam also calling with the group is already make a apply for a document. Can you explain more about that, Miriam? From what you find in the UNWRAP, so do you think the policy from the government is the important thing, or do you think the lifestyle from the people, it can help us more easier?
Forgot to unmute myself, sorry. You know, I think first and foremost, the blame really lies with the businesses and the industries that are delivering products to us. I mean, we as consumers want the product, not the packaging. So, and when you go to the store, you don't really have a choice about how the product is packaged. So I think that, yes, certainly there is I mean, when it comes to whether or not your product is delivered in a chemical-free, toxic-free, reusable glass or stainless steel or ceramic type container or no package at all, or whether it's delivered to you in a plastic sachet or some other plastic package, you really don't have much choice. So we really need to call on the consumer product manufacturers first and foremost to make better choices. But when it comes to the ability for packaging manufacturers to put all kinds of harmful chemicals in the package that migrate into our bodies, I think that's a real failure of regulation. Most of the industries that are choosing packaging don't have any idea what chemicals are in the package. And I think the chemical regulations for years have been oriented to the government has to prove that the chemicals are safe. The burden of proof is on the government. And so it's really hard to get rid of them because the government's generally underfunded and under-resourced to do that. So we need to shift the burden of proof to the chemical manufacturer to make sure that all the chemicals that are entering the marketplace are safe before they enter the marketplace.
Okay, thank you, Miriam. And for Michelle, do you already make a call for the government to ban the container from plastic in the food business in Hong Kong, or you can tell?
In Hong Kong, we have other green NGO. We have the cooperation to ask for the urge to the government to ban the food packaging container in Hong Kong. But I think the government is not really respond to our request. So it should be a long way to go to ban one single-use plastic in Hong Kong, especially for the food packaging. Because in Hong Kong, if we use the plastic bag, then we will have the test for that, but not for the food packaging plastic bag. So therefore, there's so many people, they still used to use the plastic bags for the food packaging. So we think we need so many things to do.
So you raise for people supporting you about this issue? Maybe you make a petition or something like that?
We did it, but the government has no response for that at the moment. They encourage people to use their own container to the restaurant, but it's just the encourage. It's not they must to do that. So it's not a policy to support it.
Okay, but we still need to move to support those ideas so it can change the mind of the government and the mindset of the government. So Pang, if you don't mind, maybe you can share the call for the healthcare sector is what is the point that you're addressing to the Department of Health in Philippines?
Sure, Adi. So before I answer your question, I just want to add that even before the pandemic, there is already a groundswell of awareness in the health sector. So there are already efforts to reduce their plastic footprint, carbon footprint, etc. But it has been curtailed somewhat during the pandemic. So I think what's necessary for us right now is to ask the health sector again, to remember what they have been doing prior to the pandemic and take advantage of all the policies that they have put in place to address all the environmental footprints that they have been doing in the past years, and then maybe calm down again and realize that what they have been doing so far have been putting them in track towards sustainability. And there are lots already. And I think for the Ministry of Health is to continue their Green Hospitals initiative, which would put hospitals, all of the hospitals in the Philippines, not just government-controlled hospitals, towards the path of sustainability and reduced environmental footprint, as well as towards the continuance or pursuance of their oath to do no harm.
Yeah,
May I add a point that I forgot to mention?
please, Miriam.
Thank you. You asked about our call to action in the Unwrapped project, and we do have a particular call to action for World Health Day, which is that we are calling on restaurants in the food service industry to reopen with reuse. The idea that so many restaurants during the pandemic have opted to move to plastics and disposable foodware when they may previously have been using reusable plates and cups and utensils is really not providing any greater protection for us during the COVID-19 global pandemic. Because the food service utensils, the plates and the cups and utensils aren't really a source of exposure or transmission of COVID. So for World Health Day, we are specifically calling on restaurants to, as they reopen their food service in cities around the world, to go back to reusables because they are better for the planet and safe for us to use even during the COVID-19 pandemic.
Thank you, Miriam. And Miriam, you also have a question. And for you who are watching us from the live Facebook, you can also add question in the commenter section in the Facebook. So we will address the question to our panelists. But this question came from Tara Quismundo from ABS-CBN News. Miriam, can you give us a picture of how the chemicals move from the packaging to the food? Does this mainly have to do with the heat, or are there other factors that unleash these chemicals into food from container? Please explain.
Okay, that's a great question. So different groups of chemicals, different classes of chemicals behave in different ways. When it comes to the plasticizers in plastic, things that give plastics different properties, plasticizers like phthalates that make plastic more flexible and softer, or the bisphenols that can make plastic rigid and hard. There is a pretty strong scientific consensus that a greater amount of these plasticizers migrate out of the packaging when in contact with heat. So heating food in plastic containers is really not a good idea. But it's a question of degree, because yes, like things, so there's a greater amount of migration with heat or plastic bottles sitting in sunlight, but there's still migration even without the heat, without the sunlight. But that's just one, those are just two groups of chemicals. And I'm not an expert in all of the food packaging chemicals and what makes them migrate. I think a lot of it has to do with, for example, the PFAS chemicals, or the perfluoroalkyl substances that are used to coat food, to coat fiberware and paperware to create a grease-proof barrier. Those things migrate even without heating So those things can get into our food and then into our bodies without heating. But I would imagine that a scientist would have a much longer, list or description of how the migration occurs. Well, those are the two that I know about.
Okay, thank you, Miriam. And Paing, before you are mentioned also about the waste from the hospital. From my perspective in Indonesia, most of the hospital using the incinerator to burn or the hazardous material came from the hospital waste. Maybe you can explain how the hospital from your perspective or your research doing in this pandemic, how they deal with the waste, and what is initiative are the hospital taking in relation to the plastic waste? Maybe you can explain.
Yes, so prior to the pandemic, Adi, the hospitals are already observing our environmental laws. So that would be the Ecological Solid Waste Management Act, together with the hospital's waste manual of the Department of Health. But on top of that, on the institutional levels, the hospitals that we have been working with already put in place some other sustainable steps to reduce their plastics pollution. So some hospitals are already banning single-use plastics in their facilities. Others also influence the fast food restaurants in their neighborhood to dispense reusable products, or at the very least paper products. And others are doing altogether away with single-use plastics in their cafeteria and in their dietary departments. So these are the steps that hospitals are already taking prior to the pandemic. What's sad is that because of the pandemic, some of these policies need to be suspended. So which is why, as I've said, during our waste audits, we are seeing an increase again of those types of plastic waste. So there's really a need for hospitals to enforce or implement these policies again if they want to reduce their, again, environmental footprint and health footprint in their to their patients and environment.
Okay, thank you, Paing. So the regulation is the most important thing that the government can do to reduce and to prevent the bad impact from the waste from the hospital and also the toxic chemicals from the food packaging. So Michelle, do you have any other thought about this?
So just share what we have done in Hong Kong. Last 2 years, in phase 1, we gathering around 120 restaurants in Hong Kong. All the restaurants, they provide reusable container and then do not have any one single-use plastic in their restaurant. So in this restaurant, we have 120 for our network now. We will do the promotion for them in the network to let more Hong Kong citizens to consume the meal in their restaurant. So this is the phase 1 what we did. And then in the phase 2, we get a funding, and then we found around 20 restaurants. They mainly do the takeaway delivery service. And then we give the incentive for the consumer if they take their own container to this 20 restaurants. So per meal, if they spend more than around €3, and then they will get 50 cents of the incentive for the rebate per meal. So in this program, we can encourage more Hong Kong citizens to join, and then let them to bring their own container to the restaurant. So until at this moment, this is the phase C now. We join a supermarket chain in Hong Kong. They also provide the restaurant. And then if the consumer, they bring their own container and then do not take any plastic bag or soup from the restaurant, then they would get a stamp. After they collect around 20 stamps, and then they will have the supermarket cash coupon. So this is for Hong Kong people, that is more attractive. And then another program is from the
Yes, please continue.
Also, we have another program is for other restaurants, it's more restaurants. So after they join a package, and then the consumer, they bring their own container to their restaurant, they also get the stamp, but they do not have any cash redemption. They just have the stamp, and then we will collect all the stamp, and then we will do the food donation for the people they in need for the food. So this two program is ongoing now, and then we hope that this two program will have the good result.
Okay, Michelle, the phase 1 until the phase 3, how long it takes? Is this all phase during this pandemic or starting before the pandemic, the phase 1?
Phase 1 is starting before the pandemic, so it's around 2018 to 2019, around this period.
Okay.
So for the phase 2 is from last year.
Okay, thank you so much for the, I think this is an inspirational from Hong Kong, how they deal with the restaurant. So if I'm not mistaken, I already read the report from GAIA. It's about the business unusual, already published this year. If I'm not mistaken, in general, they interview about 21 enterprises in Asia Pacific, from grocery store in Malaysia until the surplus food delivery system in Australia. Each store have a unique and inspiring story, just like Michelle mentioned before in Hong Kong, how they deal with the restaurant and how they put the stamp for incentive for the people to get another incentive. So I think it's quite good and inspirational. But all of this is still have an issue because people is not get used to the how they consume their own goods every day or daily, how they spend their money, and they're not used to get or bring their own container for not buying a food. But when they go to the grocery shop, maybe it's not their common way to doing shopping. But I think the dots that can connect all of this is the regulation and the support from the government, because in Philippines, I see by the Solid Management Act, the Solid Waste Management Act can also implement it into another issue of waste. So the regulation is something that is needed. And I think the jobs of the journalist is try to push all the stakeholders in the community and also in the public health issue and also the waste management issue, that journalists report or make a story, inspirational story that can push the government to serve better for the public, because I believe the better journalism is the better for environment. So we still have another 10 minutes. So if you guys have a question, please put your question in the chat box. And for all of you that are joining us from the Facebook, please send your question in the commenter section. And I would like back to Miriam. So Miriam, what do you think about the large amount of the chemicals that still not been identified? What is the impact for the human health? Is there any ways for people or public to understand the risk of the toxic chemicals in food packaging?
Well, Adi, it's very hard when there's no disclosure, when the regulations do not require manufacturers to test or to test the chemicals for human health hazards. So the government doesn't even have the information. So how can we expect consumers to have that information? So what we really need to do is to demand that our national governments improve the regulations, require that the manufacturers prove that the chemicals are safe before they are allowed to be put in the market, into commerce to begin with. So that's the first regulatory change that we need in order to protect our health from food packaging chemicals. But we can also have regulations that specifically ban known classes of hazardous chemicals. And what we are seeing, there are lots of lists of chemicals of concern, and we're seeing government regulations all over the world that are banning specific classes of chemicals from food packaging. Here in the States, we have a few states that have moved to ban, that have already enacted regulations to ban phthalates and PFAS, the perfluorinated alkyl substances, and in some cases, bisphenols. So those are three classes that are top priorities for removing from food packaging. So that's what I would recommend to, as a general call for improving the safety of food packaging. But the other way to improve the safety of food packaging is to stop using disposable foodware. And there are a lot of regulations, there are a lot of new policies around the world that are calling not just for a ban on single-use plastics, but also trying to figure out how do we drive business to choose reusables. And Michelle talked about, incentives so that consumers can bring reusables at a coffee shop or at a restaurant. We're seeing all kinds of regulations that around the world, some people call them latte levies or fees on the single-use coffee cup, for example. When a customer has to pay more for a disposable and the reusable is free or less expensive, that is a direct signal. That is a huge way to change behavior. And what we would like to see is not just charges for the single-use disposable products. We also want to see a mandate that these businesses that are doing takeout food and beverages have to provide a reusable to the customer, so that it's not just, I don't have to remember to bring a reusable cup or a container everywhere I go. I should be able to go and get a takeout coffee or a takeout meal and have a reusable and returnable container there that I can borrow from the restaurant or from the cafe. And we're seeing those kinds of programs pop up all over the world, and that's very exciting. So I think that's the kind of change that we need.
Okay, thank you, Miriam. But would you buy and bring your own coffee, your coffee container, if the bar or the coffee shop will give you incentive, just like in Hong Kong? Do you think it's more interesting for the consumer or what?
I think incentives like discounts and loyalty programs where maybe you get the 10th cup of coffee free, those can really incentivize behavior change. But the research shows that consumers are more likely to change their behavior in response to when something costs them more. So for putting a charge or a fee on disposables is more likely to change behavior than giving somebody a discount. That's what we've learned from the social behavior research.
Okay, thank you, Miriam. Pang, we have a question from Luke Des. He's asking, would focusing on health make consumer more likely to change their behavior? What do you think?
I believe so because health is a very personal issue. So when you talk of health, you automatically think about yourself before you even think about your family, perhaps. So when you talk about the health effects of uh, plastics, you talk directly to persons who are hearing your message for the first time. So it's very important that we frame our narrative together with the health effects of plastics, not just on the environment, but on our own personal health. So I think it's a very important angle to work on. And I think it's also an angle that people would really listen to, whether they like it or not. It speaks to their, subconscious as well as their conscious.
So if you have research before about how much people have to spend for their health if they are still maybe in the hospital, if the hospital not manage the waste in a good way.
Um, not on that line precisely exactly, but we have shown hospitals the effects of, for example, managing their wastes properly. So it's not just reducing their environmental cost; it also reducing their economic costs. So showing that to hospitals, makes them realize that they can put out money towards health services. So what they're spending now on waste disposal can be spent, because of savings towards their services to more patients. But on the question of whether or not directly affecting the health, we haven't done that, but it's going to be a wonderful idea if someone can do that, or if we can do that. But yeah, we can surely do that. It's a good way to speak about the health impacts of plastics too.
Yeah, but maybe we need to choose who is our reader. If the reader is the government, we we need to emphasize that if you don't do this, you will have a cost to manage the health of the public in this number with amount of money. But I'm curious about the younger people or youngster like Michelle. Maybe Michelle, you can share with us, is the young people or the millennial, they are more open to the incentive or they are more open to the health problem issues when we are talking about changing lifestyle and changing the way we spend our money in consuming the the product that can be waste.
I think the young people maybe they care more about the incentive instead of their health. Yeah, um because they're young, so the health problem is still far away from them. So, but if you say the mid-age people like 50, 60 years old, then they may care more about their health instead of incentive. But it really depends on that kind of people.
Yeah, thank you so much, because when working as a journalist, we need to have a lot of perspective from a different age or different group so we can manage where our story will go and who are our target. And Miriam, we have also a question from Lukdes for you. Is there any report on the surcharge info you just messaged?
Yes, I was going to put a link in the chat. There are a couple, one from Rethink Plastic and Break Free from Plastic called Reusable Solutions, How Governments Can Help Stop Single-Use Plastic Pollution. And I'll put a link to that in the chat. And also on our website at upstreamsolutions.org, we have information about surcharges and I also have a fact sheet, but not enough time to go and find it and put a link in. I'm happy to send it to the organizers so that you can send it out to our guests. And I don't know if we have more time to talk about the economic impacts of chemicals that make us sick, because I thought that was a very interesting line of information that we could delve into. I'll just quickly tell you, we had a briefing by the author of Sicker, Fatter, Poorer, Leo Trisandi today. And he said that there's a $340 billion economic impact due to chemical exposure and the sicknesses that it brings. And also his book talks about, how much money is lost when chemicals cause things like neurological disorders like autism. And there are examples in his book about how much money was, what the economic impacts were, for example, with lead. When we banned lead worldwide, there was an economic benefit of between 110 to $300 billion in economic production because of the increased levels of IQ when we got lead out of our environment. And that also, that kind of cost benefit would happen if we banned neurological toxins like these broad array of chemicals that are in food packaging.
Okay, thank you, Miriam. And for Pang, do you have final statement?
Yeah, so I think what I want to add is that, the realization that although we want hospitals to internalize and realize that they're not working in a vacuum, they're affecting their immediate environment as well with the way they operate their facilities. We also need to realize that, they have to work hand in hand with the policies that are in place by the government. So what I'm saying here is that they need help too. They need help in making sure that all their efforts to making their operations sustainable and environmentally sound will all go to waste if there's not really any policy in place that would make sure that they can pursue that for a long time. And I'm really glad that, as an example, the Ministry of Health is already doing some of those things. And I'd like to add, and I forgot to mention this earlier, that the Department of Health actually, not just the Department of Health, our government came out with their green procurement roadmap. So which means that all facilities, including hospitals, are now forced to rethink the way they purchase supplies and make sure, or any expenditures for that matter, to make sure that they are all sustainable. And if by sustainable, we also mean that it's sustainable for health. So that is something to reckon with. And that's something that I think the network also should make sure that our own government is implementing to make sure that not just hospitals, but all governmental offices are making those green procurements possible to reduce specifically plastic wastes. So let's do that. So let's work hand in hand, the health sector as well as the government, and make sure we get rid of all single-use plastics, especially the ones that are infecting us or contaminating our food sources, which means that they're also contaminating our health.
Okay, thank you, Pang, and good luck also for the memorandum. And I'm looking forward to wait your study about the waste in the hospital in Jakarta mostly. Please inform me if you already completed. And for Michelle, do you have any final statement?
I think that if we work together, we can solve this problem.
Okay, keep it short and simple, and Michelle already done it. So thank you so much for all the guests, for all the people that watching us on Facebook Live, and thank you guys for joining us in media briefing that provided by Break Free from Plastic and also GAIA. So thank you for our speakers. Thank you for Miriam. Good evening. Have a nice rest because you are the one who's still in the sleeping mode after this maybe. And thank you also for Pang, and thank you also for Michelle. I'm so sorry if I have something mistake in speaking, or I don't have any intention to make some mistake. So sorry, and thank you for joining us. See you guys in another discussion. Bye-bye.
Thank you.
Thanks, everyone.